Good afternoon, Dr. Frederic Schils. Thank you for joining today's Zoom meeting. I am very excited. Thank you. I'm very excited to discuss you about neurosurgery, how it benefits patients, especially with spinal and chronic conditions, because many patients have concerns, especially after surgery, regarding mobility and speech. So I have collected the most common questions which I have received from patients from all over the world. So before starting, I kindly ask you to introduce yourself.
Yes, thank you, Ziba, and thank you for hosting me. I'm Dr. Frederic Schils, working as a neurosurgeon in private practice in Geneva, in Clinique Générale Beaulieu. We are mainly doing spine surgery. We are also treating different kind of cranial surgeries for patients either from Switzerland or from abroad.
Perfect. So let's start from first question. What are the common conditions that require cervical spine surgery?
You may require spine surgery when you have a nerve which is impinged with a disc herniation, or when you have some arthrosis in your cervical spine, which may lead to spinal cord compression. So the goal of the surgery is to prevent pain or lack of neurological functions.
Good. Second question, how does thoracic spine surgery differ from cervical and lumbar spine procedures?
Yeah, you know maybe that the anatomy is divided in three main locations from the spine. You have the cervical area, the thoracic area, and the lumbar area. Each area has its own specificity in terms of risk and access. So, for example, the thoracic spine surgery is different because we are close to the lung and the diaphragm, and also because we are dealing with the spinal cord. So usually the spinal cord has less space around her. So it's a little bit more difficult because we cannot move the spinal cord during the surgery. So the risks are different. It's the same for the cervical, which explains that usually for cervical spine, we are going from the front, as opposed to the lumbar surgery, which is mainly due from the back, from posterior approach. That's the main difference between the location.
Okay. So what are the latest advancements in minimally invasive lumbar spine surgery?
Minimal invasive spine surgery is continuously evolving. It was mainly started something like 20 years ago with the development of tubes and illumination systems and the microscopes and so on. Right now, we have a great push from technique of indirect decompression and, for example, also percutaneous approach for treating the disc herniation or the fracture without having an opening. So right now, the big tendencies are indirect decompression, trying to decompress the nerve without the need for exposing the nerve, and with the use of implant cage or screws that can be put directly through the skin without a huge opening. So it reduces the blood loss for the patient, it reduces the trauma to the muscular system, and it helps also a faster rehabilitation.
Perfect. What are the risks and benefits of spine surgery compared to non-surgical treatments?
Yeah, when you have for example, a painful condition or a nerve which is compressed, as you say, you have always the choice between getting a conservative treatments, mainly made by medication, injection, or physiotherapy, or you can be advised to get some surgery. Surgery has its own risk that needs to be explained carefully and thoroughly to the patient before the surgery. Of course, the precise risk may depend about your precise pathology, but generally speaking, the main risk of the surgery are hematomas or infection and neurological damage, which is really reduced by the new technique of anterior access, for example, or percutaneous techniques. Of course, each patient will receive a complete information before the surgery to detail the risks which are specific to his own condition.
Understood. How long does it take to recover from cervical, thoracic, or lumbar spine surgery?
Usually cervical is the faster because you are not touching the huge muscles which help the patient to move or whatever. So if you receive a cervical spine surgery, most of the time you can leave the hospital already the next day, and you can already walk and going outside or drive your car within days. Of course, you are not allowed to do very high demand sports or racket sports like tennis, squash, or whatever. You cannot lift heavy weights, but you can get a normal life, I would say, within days or within 2 or 3 weeks maximum. For thoracic and lumbar spine, it's a little bit different because you are also able to walk usually immediately. Already when you are in clinic, you have a team of physiotherapists which help you to mobilize correctly and which will teach you how to protect your spine, motion that you need to be careful about. But to go back to usually work activities after a lumbar spine surgery, it's usually between 4 to 6 weeks. And going back to sports activities is usually about 2 3 months.
Perfect. Can spine surgery help with chronic back pain? And how effective is it long term?
Yeah. Regarding back pain, it's a general terms and a lot of things may be included inside. Spine surgery is only a part of the answer because as you said earlier, for back pain, usually the patient will start with some conservative treatment, and it's only when we can attest that the conservative treatment is not efficient after a few weeks or after a few months that you may consider spine surgery for back pain. The difference is that usually for back pain, there is no direct nerve compression. It's mainly a cartilage degeneration. And then we have a lot of new techniques to replace the full disc, the full cartilage, and especially with mobile implant like artificial disc or disc prosthesis, which can be used either in cervical or in lumbar area.
Okay. What rehabilitation is needed after spine surgery for faster recovery?
Sorry, I didn't hear the question correctly.
What rehabilitation is needed after spine surgery for faster recovery?
Yeah, that's true. So when we are performing spine surgery in Geneva, we have already in-house some physiotherapists which will teach the easy exercise that the patient is able to do on his own. So, for example, if you receive cervical spine surgery, you do not need to spend a couple of days after the surgery in another rehab institution. But for, let's say, heavier surgery or more complex surgery, we are partners with different clinics in Switzerland, and we can send them for specific rehabilitation with physiotherapists, which knows our way of dealing with patients, so they know how we would like to proceed, and we have a clear communication with them about the, let's say, the steps of the rehab. Usually, the patient is able to stay over there something like 2 3 weeks, and within this period, he should be able to do most of his activities when he's going back home.
Perfect. Are there age restrictions or health conditions that may prevent spine surgery?
It's a little bit the same answer as for the risk related to surgery. Age by itself is not a limiting factor. You can have very old patients which are in very good health, and sometimes younger patients which are suffering from very difficult, complex medical condition. So basically, the age itself is not a limitation factor. We are every week operating patient over 85 or even close to 90 years old. And there are also some specific pathologies for this patient. For example, if you are suffering from osteoporotic fracture, it's classical that you are dealing with older patient. If you speak with disc herniation, usually it's mostly young patient. So age by itself is not a condition. Of course, we will take attention to each specific consideration of the patient, to be able to propose him the best treatment with the less risk possible. And there is an assessment with the anesthesiologist regarding specific risk that we may encounter.
Perfect. How does spinal surgery impact mobility and daily life after recovery?
Our goal is to try to have no impact, or at least only positive impact, because you know, we are lucky and we are dealing with something which is not a disease. Like if we are speaking with, you know, different internal medicine or oncological condition where there is really a disease which is limiting the expectation, for example, of life of the patient. Most of the case in spine surgery, we are dealing with some mechanical problem, and we are very efficient to solve this mechanical problem and to let the patient go back to his usual activity. So the goal is to help the patient to go back to a normal life, or to be able to practice the sports they like, they do the work they like, or to travel if they would like to travel. So we usually are able to get a real impact on their quality of life.
Good. Now I have a couple questions about brain surgery. What
Yeah.
are the most common types of brain tumors that require surgical intervention?
In our institution, most of the tumor are benign tumor like meningioma, which is a type of tumor which take place in the surrounding of the brain, not really inside the brain. It's inside the skull, but not inside the brain. It's like a tumor of the envelope of the brain. These tumors are very frequent in terms of statistic, and they are usually more frequent over aging. So we can detect them around 30, 40 years old, and the main age for operation is usually around 50 to 60 years old. The good thing is that they are benign. So it means that if we are able to remove this tumor completely, the patient is totally cured. There is no need for additional treatment like chemotherapy or radiotherapy. Of course, we are also dealing with other type of tumors like primitive brain tumor like gliomas or metastasis.
Perfect. Next question, how are hematomas in the brain treated surgically and what are the risks?
Can you repeat the question, please? I didn't hear it.
How are hematomas in the brain treated surgically and what are the risks?
Yeah, exactly. So we need to divide the two categories of hematoma. We have what we call acute hematoma. It means when the blood is quite fresh, the trauma or the apparition of the blood is recent. And this blood is not usually very fluid. So we need to do an opening in the brain, which is a craniotomy. And then the risks are a little bit higher because the trauma is acute and the patient can get some edema or some additional lesion, for example, if it was a car accident or a motorcycle accident. But the goal is to take out the blood outside of the brain or outside of the skull without touching the normal brain. That's the part for the acute hematoma. Most of the time, we are dealing also with chronic hematomas. The blood is there since a longer period, and sometimes it already has degenerated a little bit. So the blood is more like water, and usually we can remove this collection with a small point. We don't need to open the skull correctly and completely. We can just do a small hole and do an aspiration of the blood in chronic hematomas. Even some hematomas may be treated without surgery with specific medication, for example, or embolization of small arteries, which are leading to hematomas.
What improvements have been made in neurosurgical techniques for brain tumors?
We have continuous improvement regarding the technique, aside from the classical microscope and neuronavigation, which is basically like a GPS that we use when we perform brain surgery. we are able to send immediately the picture, for example, of the MRI in a computer that can help us to design the best trajectory to access the tumor, or during the surgery to be sure that we are in a correct trajectory to reach the tumor with the less risk. So that's quite right now classical. Depending of the tumor, for example, we can also inject the patient some tracer that with ultraviolet light illumination, for example, will confirm that we remove the complete size of the tumor. And we have also right now the robotic, which is coming in brain surgery, robotic arms, which are helping us to get a very precise and accurate motion. That's the main progress that we are seeing right now.
What are the risks of brain surgery and how are they managed?
The risk of what?
What are the risks of brain surgery and how are they managed?
Okay, yes, correct. It's a little bit like for spine surgery. The risks are, let's say, general, related to surgery in general. So it can be the same like hematoma, infection, or whatever. But usually for the patient, the most important risk is usually the neurological issue. And when we are talking about brain surgery, the risk is different regarding the location of the brain we are talking about. So, for example, if you are dealing with an expensive tumor which is located in the cerebellum location, you can have some gait disturbance, some swallowing difficulties, or if it's located in another direction, you can get some, let's say, weakness of one part of the body. You can have some speech disturbances. You can have some visual impairment. So it's really depending about the location of the pathology and also the type of the surgery which will be conducted. So most of the time, if your patient have a specific question regarding the risk, we need to be able to see the MRI or the examination before the surgery to be able to explain precisely for him what are the risks, because it's also very important to do not stress the patient with a very long list of risks which have zero chance to happen because it's not their problem. So usually you are mainly talking about the risk that your patient may face in his specific situation.
And how soon can patients regain normal speech, movement, and cognitive function after brain surgery?
Again, most of the time we cannot promise miraculous, but most of the time we are able to remove the process or the problem without any side effect. So most of the time there is no need for a specific recovery because there is no sequela. If some sequela happened because it was more complex surgery or because it was located close to very important structure, then of course there are also a very large range of speed of recovery depending on the age of the patient, the general condition of the patient, and also the need for potential other treatment. I will provide you with an example. If you remove a tumor in a very young patient and he has transient weakness of one side of the body, most of the time the neurological weakness will recover in weeks or months. It's very, very rare that it will take more. But if you operate somebody that needs to get some chemotherapy afterwards or radiotherapy afterwards, or if it's an old patient with a couple of other medical disease, of course, it can be longer, and we cannot always promise a complete recovery if there are additional comorbidities.
Great. And can we ask to share your latest success story, patient, especially with risky conditions that came to Geneva, to hospital, and had a successful surgery?
Yeah, I can provide you with a very recent example because we were contact from a patient from Belgium. He was actually living between Switzerland and Belgium. He's from French origin and he lived most of his life in Mauritius. And he was in Belgium and he was diagnosed due to some, let's say, headaches. He was diagnosed with a tumor, a brain tumor. So it was a very huge surprise for him because he's very good health. He's close to 45, very active businessman traveling all over the world. So he was proposed to get surgery in Belgium the week after, and he decided to do the surgery with us in Geneva. When we look at the pre-op MRI, it looks like a malignant tumor, unfortunately, which is of bad prognosis and may need a couple of other treatment. And even if you are able to remove the tumor completely, the rate of survival for the patient is very low. It was the expectation. So we proposed the patient either a biopsy or a complete removal. He decided for a complete removal that we did something like 3 weeks ago in Geneva. And we were very lucky because, first of all, we achieved to get a complete removal on the MRI without any side effect for the patient. So he has no neurological sequela. And the diagnosis was for him a lymphoma, which is very rare primitively in the brain, but which respond very well to chemotherapy. So the prognosis was totally different what we expect. And the patient is right now with a very good prognosis without any neurological impairment, and the rate of success of the treatment will be over 90%. So he can go back in a few months in normal life. And in the
This is
past, we
inspiring
predict.
story.
So that was our latest one.
And I remember that we discussed about a patient from Kazakhstan, young lady, during our meeting. Could you please share this experience also?
Yeah, very good. I remember of a very young lady which was suffering from chronic back pain, and she was also prognosed of never being pregnant in the future due to back pain condition and so on. So she went to us in Geneva, and we make a diagnosis of very inflammatory disc disease on the lumbar spine between the last lumbar vertebra and the sacrum. And because she was less than 30, we decided to go for a complete disc replacement from the front. So we did an anterior approach to the spine, and we did that with a general surgeon. She was able to stand up the same day of the surgery. She spent only 3 days at the clinic. She was immediately delivered from back pain, and she sent me afterwards the birth announcement of his very young boy. So she was able to get pregnant after the surgery, and she has two kids since then.
This is magical story, and she didn't need any rehabilitation.
No. She went back to Kazakhstan something like 3 weeks after the surgery.
Wow, she's very lucky that meet you. Thank you, Dr. Frederic, sharing your expertise. I hope that this meeting will be very helpful to patients, especially who are looking for spinal and brain surgery, to give valuable information. And if anyone needs doctor consultation or if patients still have any questions, just feel free to leave us a message on WhatsApp. And don't forget, we are here supporting you on your health journey. On your next live session, we will meet you again.